Question: A 65-year-old man presents with progressive weakness and muscle wasting in his upper limbs. He has difficulty gripping objects and experiences muscle cramps. On examination, there is significant atrophy of the hand muscles, and fasciculations are observed. Nerve conduction studies reveal reduced compound muscle action potentials, CMAP, amplitudes and increased motor unit action potential, MUAP, recruitment. What is the most likely diagnosis? A. Amyotrophic lateral sclerosis, ALS. B. Carpal tunnel syndrome. C. Guillain-Barré syndrome. D. Multiple sclerosis, MS. The most likely diagnosis for this patient with progressive weakness and muscle wasting in the upper limbs, along with atrophy of hand muscles, fasciculations, reduced compound muscle action potentials, CMAP, amplitudes, and increased motor unit action potential, MUAP, recruitment on nerve conduction studies, is A. Amyotrophic lateral sclerosis, ALS. This patient's clinical presentation and the findings on nerve conduction studies strongly suggest a diagnosis of amyotrophic lateral sclerosis, ALS. Here's the rationale for choosing this diagnosis. Progressive upper limb weakness and atrophy. Progressive weakness and muscle wasting in the upper limbs, along with significant atrophy of the hand muscles, are classic features of ALS. ALS is a neurodegenerative disorder that primarily affects the motor neurons in the brain and spinal cord, leading to muscle weakness and atrophy. Fasciculations. The presence of fasciculations, which are involuntary muscle twitches, is a common sign in ALS. These fasciculations occur as motor neurons degenerate. Nerve conduction studies. Nerve conduction studies revealing reduced CMAP amplitudes and increased MUAP recruitment are consistent with the motor neuron involvement seen in ALS. In ALS, motor neurons degenerate, leading to reduced nerve conduction amplitudes and increased recruitment of motor units to compensate for lost motor neurons. Options B, C, and D are less likely in this case. Carpal tunnel syndrome, option B, typically presents with symptoms in the hands, such as numbness and tingling, rather than muscle atrophy and weakness, and it does not involve fasciculations or the characteristic findings on nerve conduction studies seen in ALS. Guillain-Barré syndrome, option C, presents with acute or subacute motor and sensory dysfunction and typically starts in the lower limbs before progressing upward. It does not cause the progressive, chronic, and asymmetric weakness seen in this case. Multiple sclerosis, option D, is a demyelinating central nervous system disorder that presents with a variety of neurological symptoms, but it does not typically cause the progressive muscle weakness and atrophy seen in ALS. Central nervous system. Multiple sclerosis, the clinical presentation and the nerve conduction study findings are highly indicative of ALS. Option D, a neurodegenerative motor neuron disease. Multiple sclerosis should be evaluated further for ALS and appropriate management. Multiple sclerosis